In today's video, we're going to be talking about frozen shoulder, also known as adhesive capsulitis. Hey everyone, it's Joy here, chartered physiotherapist and the proud founder of the London Physio. Now, we are a virtual physiotherapy service that you can tap into from anywhere in the country. We also do home visits anywhere in London and anywhere in the Midlands. So if you need a physiotherapist to help with your frozen shoulder or anything else, or you need a second opinion or one-on-one advice, then feel free to tap in. It's all the w's.thelondonphysio.co.uk. You can book a session in less than 2 minutes. Now, this is why it's actually really important to see a physio, because not every painful and stiff shoulder is a frozen shoulder. Although I'm going to be showing you my favorite exercises for frozen shoulder that my patients have benefited from tremendously over the years, although I'm going to be showing you those, it's important to note that frozen shoulder is actually a secondary diagnosis. Now, I know it sounds like a lot already, so I'm going to break it down. A secondary diagnosis is something that happens as a result of something else. So yes, you probably have frozen shoulder right now, but there might be an underlying reason as to why you have frozen shoulder. It could be an impingement, it could be a muscle tear, it could be all sorts of things. Then as a result of the pain, they're not moving the shoulder as much, and then it becomes frozen shoulder. So as well as treating frozen shoulder itself, we have to treat the underlying symptom, which you may not know until you've seen a physio. So if you have frozen shoulder or someone else you know has frozen shoulder, make sure they see a physio to find out what that underlying cause is. And so that once the frozen shoulder is cleared, they can deal with whatever is underlying. Your physio will be able to guide you. As you already know, in this video, we're going to be focusing on the frozen shoulder aspect. Before I show you these exercises, I do want to let you know that it is called adhesive capsulitis for a reason. Adhesive meaning adhesion, and then capsulitis, which comes from the word capsule. So it's the adhesion of the capsule that surrounds the shoulder joint, the glenohumeral joint to be specific, the ball and socket aspect of the shoulder. Now, this capsule has a pattern, meaning this is exactly how you know if you have frozen shoulder. The capsular pattern goes like this. First, you lose external rotation, which is when you turn the ball out of the socket. Then you lose abduction, which is when you take your arm out to the side going all the way up. And then you lose what we call flexion, which is when you're lifting your arm forwards going all the way up. Now, depending on how far into your symptoms you are, all three movements will most likely be restricted. However, they will follow that pattern exactly. The most restricted will be external rotation. The second restricted will be abduction. The third restricted will be flexion. It is also worth noting that you could be in different stages of adhesive capsulitis. So the first stage tends to be the painful stage. If you're in the painful stage, you may not have lost a lot of movement, but you will be very, very painful. So you really want to focus on pain management, but you also want to make sure you're doing these exercises to avoid going into the freezing stage, which is where you then lose the movement. If you're already in the freezing stage, then you're probably not as painful, but you lack these movements that I've just mentioned. So 100% you want to push as much as possible into the pain, into the end of range. It's not pretty. It's never nice. It's really painful, but you have to do it, because for some people, these symptoms can last up to 2+ years, and you definitely want to avoid that if you can. That being said, I'm going to show you 5 of my favorite exercises. The first 2 would be warm-ups, just to get the shoulder mobile and to get the shoulder moving. The last 3 you're going to need a stick for, and they would cover the movements that I've already mentioned. Now, it could be a mop stick, a walking stick, a curtain rail, whatever stick you've got. It doesn't have to be fancy. It just needs to be a stick, because you're going to use the stick to help you push into the end of range with your good arm, whilst you relax the arm that you're actually exercising. Now, without further ado, let's get into it. Exercise number 1 is shoulder rolls. So essentially, you're just going to stand up nice and tall, drop your shoulders down. This shouldn't hurt you, the starting position. Now I want you to lift your shoulders up towards your ear, roll backwards and downwards, okay? And that's your first circle. We're going to do that about 10 times just to warm up the shoulder. Amazing. Now I want you to switch directions, okay? So you're going to do exactly the same. Lift up, bring your shoulders forwards and down, and then go backwards. Now, if you're in a lot of pain with this, don't worry, just start off with smaller circles and then you can make them bigger as you go on. You don't have to go straight into big circles, but if you can, I really want you to get to the end of each range. If you're going up with the shoulder, go all the way up. If you're going down with the shoulder, depress it all the way down. If you're going around with the shoulder, I want you to really sweep as though you're getting to the end of range for each position. That should warm up your shoulder nicely. So for exercise number 2, you're going to need a chair. It could be any chair, but I would advise a chair that is much lower, because what I want you to do is move the chair forwards, take a few steps back, and I want you to bend forwards from your hip as if you're hinging from the hip, okay? Then I want you to drop that shoulder down, the one that's actually frozen that you're wanting to exercise. I want you to drop it down and I want you to do what we call a pendulum. So you're going to swing, essentially. You're going to swing forwards and backwards. You could start with small movements. They could be really slow if you're very painful. And then you could go into bigger movements. What I don't want you to do is to actually actively move the shoulder yourself. I want you to just let gravity pull that arm down. I want it to feel like a heavy weight as you swing forwards and backwards. Then you can give yourself some more space and you can swing sideways. So you move your body out the way and then essentially you swing sideways. Again, you can start with smaller movements like this, and then you can go into much bigger movements. As much as you can, try and avoid active control. Just let the arm drop. In fact, you could use your body if you want to kind of sway side to side. Now in this position, just make sure you get your core engaged so that your back is actually protected. From here, you can also do a circle, a pendulum circle. So you could start with smaller circles one way and then go into much bigger circles. And then you could do smaller circles clockwise and then go into much bigger circles clockwise. So this entire exercise is the pendulum. Feel free to pick what you want. So you could pick, just swinging forwards and backwards. You can pick swinging sideways. You can pick going around in circles. Whatever you prefer, totally fine. For the next 3 exercises, you're going to need a stick. It doesn't have to be anything fancy. I've literally got 1/2 of my curtain rail. It could be a walking stick or anything at all. So what's really useful with this is that there is a knob on the end, because it means that I don't have to grab it. I can just put the palm of my hand here and exercise it. Now, the purpose of having a stick is that, assume this is the arm that I'm exercising, okay? This is my frozen shoulder side. This arm is actually going to be doing the work, and the stick would be an extension of this arm. So let's start with external rotation. Remember, the movement that I said would be the most lacking. So with external rotation, you want to keep your elbow by your side, keep it tucked in, and the idea is that you want your forearm to rotate. So the ball is rotating out of the socket, but you want the elbow tucked in. If you rotate your body, obviously, you can see how that doesn't work, right? Also, if you take your arm away from your body, you're doing a completely different exercise. So if you're struggling, actually, I'd say grab a pillow or a cushion or something, a book. Keep your elbow there, because the moment your arm goes off, then the book or the pillow or the cushion drops, okay? I'm gonna keep my hand like this so that my thumb's facing upwards and my fingers are facing forward. So that way I know that as I go out, I'm getting the rotation in my shoulder. Now, if you have frozen shoulder, you will know that this movement would be very, very painful. So what I'll say is just take a deep breath at the end and only go as far as your pain allows you. Not as far as when it starts hurting. It has to hurt, but as far as you can bear, okay? Don't make it excruciating, but it has to feel like you're getting to the end of range. Because remember, what we're trying to do here is we're trying to get new movement. Or if you're in the painful phase, we're trying to avoid losing the movement altogether. So you really have to push into the end of range. Try not to twist your body. Try and just take your arm out to the side. Keep the thumb facing up and the fingers facing forwards. That just gives you an idea to let you know that you're doing the right exercise, okay? If you're struggling with twisting your body, you can do this against the wall, or you can do this laying down. So that way your body has nowhere to go. All the exercises we do with the stick, I need you to relax that frozen arm as much as you can. Don't actively do the movement with that arm. Let the other arm help. Use the stick to do the movement. Perfect. The next exercise is abduction, abduction. So this is the one that is lost second. So the second most restrictive after external rotation. So for this, I want you to have your elbow straight this time. And again, I'm focusing on exercising this arm. So this hand is going to be doing the pushing whilst this one is going to be relaxing. Okay, so this arm is pushing. The main thing here is I don't want you to bring that arm forwards. Okay, you're not going to want to take it backwards anyway, but don't bring it forwards to compensate for the movement. Make sure the arm stays in line with your body to the outside of your body and you're going upwards, okay? Obviously, if you have frozen shoulder, you may not be able to go all the way up. That's totally fine. Just go to as far as you can, but just remember these exercises are going to hurt, my dear. These exercises are going to hurt, my guy. You just have to do them, okay? Because the pain now is worth it compared to having, no use of your arm for like 2 years. And of course, make sure that you're taking some pain meds as well, because you're going to need that. If you're struggling doing this standing, you could do it sitting. And actually, if you are very painful, I will suggest do it lying down, because I need that arm to not leave the floor. Essentially, I need the arm to slide against the floor so that way we know that the arm is sliding to the side of your body rather than forwards. Final exercise. You can hold on to the stick if you want to, but to be honest, you don't actually need a stick for this one. This exercise is called flexion, and essentially you're going to be bringing your arm above your head. Now, the reason why we need something, whether it's a stick or you using your opposite arm, is that we need that arm to be doing the work for the other arm, like I said before. So if you're going to use the stick, what you want to do is make sure that both arms are straight. So the elbows are straight in front of you, and then you want to kind of go forwards, but using this arm to do the lifting, okay? So the arm you're exercising, it doesn't need to do anything. The arm that you are not exercising needs to do all the work and pretty much help using the stick. So with this, the goal is to try and get the arm above your head towards your ear. Obviously, if you've got frozen shoulder, that might not be initially possible. So you may, depending on how far gone you are, you may be getting to about here. That's fine. You just go all the way. Push right into that end of range. Go all the way. And then just keep trying to push a little bit further each time. And just remember, this arm is not doing the work. One thing I definitely don't want you to do is bend backwards if you're doing this in standing, okay? So if you're doing this in standing, what we find a lot of people do is they try and bend backwards, but actually in reality, you're just bending your spine. You're not actually bending the shoulder or lifting the shoulder. So if you're struggling with that, do it with your back against the wall or do it laying down in bed. If not, then just keep your spine still and try and move just the arm. Welcome back. I hope you enjoy doing these exercises as much as I enjoyed filming them, and I'm also hoping that your shoulder is feeling a little bit looser and much better now. If you know anyone that would benefit from these, then please send them this video, because frozen shoulder is no joke. People really suffer with this, and honestly, all they need are the right set of exercises to get going. Now, remember I said at the beginning of the video that frozen shoulder tends to be a secondary diagnosis, meaning there's something underlying, possibly, that we are dealing with that caused you to be in pain and led you to have frozen shoulder. So if you have frozen shoulder or someone else you know has frozen shoulder, make sure they see a physio to find out what that underlying cause is. And so that once the frozen shoulder is cleared, they can deal with whatever is underlying. It could be an impingement, it could be a muscle tear, it could be all sorts of things. Your physio will be able to guide you. And of course, you can tap into our service. So if you need a physio one-to-one, or you need a second opinion if you have a physio already, then you can tap into us. It's allthews.thelondonphysio.co.uk, and we would be more than happy to help you out. Until next time, look after yourselves and each other.